My name is Nurse Esther Solomon-Okorozo, and I'll be discussing about ulcer today. Stomach ulcer. There are pictorial formats that will be attached to this video. Don't forget to listen and ask your questions when necessary. An ulcer is simply a sore in the lining of your stomach. An ulcer is simply a sore. Remember, whenever you bite your tongue, and when you bite your tongue, it's now be as if there's like a perforation on your tongue, and then mommy, see my tongue. Look at it, you find that there is something there. That's what an ulcer looks like. Look at this pictorial format now. This is an ulcer. So any sore in the lining of your stomach. We'll be looking at different types of ulcer. Look at the presentation where they are. The first one that we're having is esophageal ulcer. Esophageal ulcer is gotten from the esophagus. That means there is an ulceration there in the lining of the esophagus. That's your throat that you usually call. The next one is gastric ulcer. Gastric ulcer is when they say sore and the lining of the stomach. That's the one that most people usually know of, gastric ulcer. The next one is peptic ulcer. Peptic ulcer is now when there is an ulcer that's a sore and the beginning of the small intestine, when there is a sore and the beginning of your small intestine. So look at this pictorial format and you get it. Let's talk about the symptoms of stomach ulcer. The symptoms of stomach ulcer. Number one, have you heard of heartburn? Someone said, I'm having heartburn, indigestion, pains in the stomach region. Have you seen when someone is vomiting blood? Dark stool all the time, no matter what the person eats. We also see weight loss. Why am I just losing weight? Yes, stomach ulcer can cause that. We also see appetite change. Instead of the normal things that this individual is meant to eat, he will not or she will not be eating them. There will be an appetite change. We also see nausea, tendency to vomit everything that he or she eats. We also see feeling of fullness. Every time you're feeling full, you're okay. But truly, you know that you have not eaten something reasonable today. Now, what even causes this stomach ulcer? That means what predisposes people to have the stomach ulcer? There are two things I'll be looking at. The first one is Helicobacteria pylori. That's the microorganism that causes um stomach ulcer. They used to call it H. pylori or NSAIDs, non-steroidal anti-inflammatory drugs. That means NSAID. That means drugs like paracetamol, ibuprofen, that most people use them as painkillers. These are the major causes of stomach ulcer. When food is being digested into the body, that means either from water or food, and it is contaminated, having this microorganism, that's H. pylori, there is every tendency that over time this microorganism invades into the wall or the lining of either the esophagus, the small intestine, or the stomach, and then causes harm, which brings about the sore, also known as ulcer. We also see that this causes infection. What are the risk factors that predispose people to having ulcer? Number one, family history. If you know that your family has a history of ulcer, you are predisposed, you are liable to have ulcer. We also see smoking. We see spicy foods. I love Indomie too much. I will use all the spice. I will use curry, like too much spicy nutrients used in cooking food. Sometimes these spicy nutrients can be replaced with the original, just like someone using spicy ginger ingredients when they know that ginger is available naturally. So these are the things that can predispose one to ulcer. We also see drinking alcohol, and it is mostly common in females. Unmanaged diabetes can also lead someone to ulcer. The complication of this ulcer is that there will be bleeding. You see, that's why they vomit. Perforation, that's small, small holes, which leads to sepsis, that's infection. And the last one is stomach cancer. There is treatment, and you have to see your doctor, get tested, and you'll be okay. Thank you very much.